Tonight, it's a deadly virus with a rather sexy name, Marburg. That is devastating. Don't let the name fool you. If you read the literature, and the BBC reports this, that it's in the same family as Ebola. So it's a very, very deadly disease indeed. What do we know about it? There is an outbreak of it in Ghana. The thing is, although it's that deadly, we are not talking about it enough. We're doing a lot of things, talking about politics, the economy, obviously, but we're not talking about the thing that will kill you. I mean, I know people are hungry because the economy is in a bad shape, but at least, I mean, you'll survive longer. But this one, it's almost a death sentence, almost a death sentence. We'll talk about the fatality rate pretty shortly when I speak with my experts. Is that in the process of trying to get this under control, finding, patient zero, but also drawing back to where did he get it from?
Yeah, so good evening to your listeners and good evening to my senior colleagues. I think that in public health response, if you really want to break the chain of transmission, then you need to identify the index case, or at least know the source of the infection. And in this case, it could either be from wildlife to human or from human to human. We'll be more worried if there is a human-to-human transmission, and the cases we are recording are not the index cases. So in that case, we assume the index case is still at large. That would be a serious situation. But in this case, if it's just from wildlife, maybe from bats, or if the person has visited, caves, or he's a miner or something that prolongedly expose himself to those sources, then that probably might be the source of the infection. And in that case, then we've been able to identify the two index cases, and that wouldn't be a concern for.
In that case, once you identify that latter scenario, you just deal with the human being with it,
yes,
and hope that, of course, and look at his contacts.
His contacts, exactly.
Exactly. Dr. Clay, what do you say to that?
Yes, I think he's made quite important points. Even though our intention is to educate the public, it's also very crucial not to sound a panic alarm, because, as he rightly said, the case fatality.
I like when you talk to experts. I am fantastic talking to experts, but me as an ordinary person, when I heard it and I read the symptoms, I was alarmed.
Yes.
I'm so very calming hearing all of you say, don't panic.
Yes, I think it's very important to stress that, because he also did mention that the mode of transmission is such that you have to be in direct contact with someone who's infected.
I've heard that a lot. What is direct contact? Define it for me.
Okay. So direct contact means that you come in close proximity with substances that are infectious.
Would this distance qualify?
Not at all.
Okay.
So you have to be in direct contact with fluids that are known to contain the virulent agent. So, for example, if somebody's bleeding, there's blood. If you touch the blood and you have exposed skin surfaces, you could get infected. If somebody, let's say urine or saliva, or...
So you can get it through saliva?
Yes, and in some cases, even in semen. So these are when you come directly in contact with them. And then the materials that the person might have used, so maybe the bed sheets and all those things, if there are fluids on it and you touch it, it's most likely you'll get infected. But until you get directly in contact with those things, you are not at risk. So as Dr. Titus rightly said, the most important point, if you take out the zoonotic origin, it's the healthcare workers, those who have a high index of suspicion, those who are able to diagnose this are usually at higher risk of getting the infection. And of course, those who are able to handle these samples, because samples from these patients are usually classified as biohazard level 4.
So let me ask you, can I get it if, say, we are sitting here and say you cough and it's, can I breathe it in Can I get it through that?
Yeah, so classically, we don't say it's airborne.
Okay.
Right, so Marburg, Ebola, and the other hemorrhagic fevers are not classically airborne infections. So the probability of you getting it if you're sitting across, it's very unlikely.
But if it settles on the surface,
yes,
and I touch it,
most likely,
and I rub my eye,
exactly, mucous membrane,
I will get it.
You can get it.
Okay.
Yes, you can get it.
Okay.
So it's deadly. Yeah, it's maybe from 27 up to 88% mortality. So currently in Ghana, we will say our case fatality rate is 100%. But
for the two who got it,
yes,
or the two we know who had it,
have died. But technically, it's not that easily transmissible. So
okay.
It's not as bad as it is. But I must also commend the public health division for the prompt response, because we all know the immense strain that they are in. Currently, they are responding to monkeypox, COVID-19, and now Marburg. And it's the same health personnel who are dealing with these contact tracing and all that. So I must recommend them for doing a great job.
I mean, Dr. Sir, health expert, health advisor. I mean, nowadays, because of Corona, anywhere in the world where something like this happens, almost the whole world reacts to it very quickly. So this was expected, is it not? That the World Health Organization, everybody else will mobilize to come in.
Yeah, so I think that with increasing urbanization and technological advancements, international travels and all that, when a disease of this nature pops up somewhere, because of its sudden nature, it's been relatively rare. The international body usually react in some way just to make sure that it is really contained, because so far we've had 6 cases of diseases that are of public health concern, international concern.
I mean, since Ebola, since coronavirus came, there's been
so coronavirus
part of
yes, the Zika and the rest. So we want to make sure that we never get there because of the potential public health implications. And as Dr. Asidu Bequin said, I think Ghana has done really well. Our public health infrastructure, even though it's a bit deficient, we are doing a great job because I think in 2021 there was this index that they revised, the Global Health Security Index, and in the component of early detection of viruses of pandemic potential or epidemic potential, our potential point increased by 10. So that is a really good point there. So I think that as we've all discussed, it's not to sound the alarm, but we have to look out for. And one plea that I would also want to give the Islamic community, I've worked in the clinic before, usually when someone passes on as a Muslim, the families,
very quickly, yes,
the families want to rush and bury a person. So it's very important to engage the people at the community level, let them understand what we are dealing with, so that in case a family member or a relative suddenly becomes ill and having complications, they will have the patience for the health workers to deal with it in an appropriate way.
Thank you, Dr. Banda Khalifa, Dr. John Amoisi, Dr. Titus Bayo, Dr. Michael Owusu. I'm grateful. Don't panic, but be vigilant.